Hi there. Have you been diagnosed with Crohn's or ulcerative colitis and also been diagnosed with a mood disorder, depression, anxiety, bipolar disorder? And have you been struggling with the emotional component of this disease? Do you find that um, the emotional components of this disease make it difficult for you to move into a healthier space, to remember to take your medications, to do some of the lifestyle factors that you could change and improve your health, but because of the way your mental state, your mental health is, it's a real struggle to do some of those interventions. This is a problem for many people with Crohn's and ulcerative colitis, and it's a very important piece of the puzzle that needs to be addressed. Hi, my name is Dr. Christina Campbell. I'm a functional regenerative medicine physician, osteopathic trained. I'm also board certified in emergency medicine, and I've been practicing medicine for a little over 20 years. And I want to talk a little bit about the biophysiology of why these diagnoses of these disease processes are so intimately connected. And it has been in the research and in the literature on Crohn's and ulcerative colitis long before we had multiple medications. When we only had one or two medications on the market still to treat it, it was well known that there was a very close uh, 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 intimate relationship between depression and anxiety or mood disorders and Crohn's and ulcerative colitis. Those connections have been well established for many, many years in the literature. And it has been a source of embarrassment for many people who've been diagnosed with Crohn's disease. And I know exactly how that feels. And I'll tell you because I was diagnosed with Crohn's when I was 12 years old, and was very, very ill at the age of 14. And in the process of trying to learn about this disease that I was diagnosed with, I found this intimate connection noted in the literature on many, many occasions. And for me, and this was in the 1980s, but for me as a teenager, I was embarrassed on many levels. I was embarrassed because this disease can be embarrassing. Many of the symptoms of this disease, bloating and gas and abdominal pain and distension, and you can't button your pants up all of a sudden. And it's not like you gained weight in 5 minutes, but you just ate something that has caused you bloating, and now it's a very embarrassing, can be a very embarrassing, difficult to deal with disease. But then you add to that the emotional components and the diagnosis of depression and anxiety and things like that. And now you have you've added yet another stigma to this disease, and something that's very difficult socially to talk about. And I will be honest with you, it was a very long time. Nobody knew, except my very closest of friends and family, knew that I was diagnosed with this disease when I was. There were very few people that I discussed it with along the way, and I certainly never told anyone in medical school my story. I certainly didn't broadcast it. It was kept kind of well under wraps throughout my career in medicine, until I realized that I was really doing not only myself a disservice, but I was doing a disservice to my patients and to those I could help if I talked about it. And so I wanted to kind of bring this to the light today a little bit and to say, one of the most difficult things when you're dealing with a difficult illness is to also be dealing with an emotional component of that illness. And, many people find that it's difficult to motivate themselves to make certain changes that might actually help their disease process just because they're feeling so down. And there's real physiologic reasons why this happens. And the first reason is the vagus nerve. And the second reason, um, these are the two main reasons, and there's a lot of reasons, but these are the two main reasons. The second reason is that 3/4 of our neurotransmitters are created in our gut. They're not created in the brain, and they're created in the gut and used in the brain. So when you have poor gut health, when you have inflammation, inflammatory bowel disease, even the diagnosis tells you what the main problem is, right? When you have something like that going on, your inflamed bowel lining is not secreting and creating the neurotransmitters that your body needs. It's just not. And so you become out of balance in the brain in addition to the gut. And that makes it difficult to think, and it makes it difficult to make good decisions, and it makes it difficult to cope. And so this becomes this negative downward spiral, and I see it so often in Crohn's patients, and I feel it's a very important place that we really need to be conscious of. We need to be compassionate about. We need to be intervening as practitioners, as friends, as human beings. This is something. It's a topic that needs to be talked about, and we as Crohn's patients or ulcerative colitis patients need to have a level of understanding and self compassion, I suppose, self forgiveness, self awareness, understanding that some of what is happening is due to the inflammatory process and a little bit out of our control unless we have some help. And so that's where this video comes in. I wanted to bring this to light and bring it up as a conversation that needs to be started with any of your patients. And if you are a Crohn's or ulcerative colitis patient, it's something you should be talking to your doctor about and helping to intervene both at the level of the gut and also at the level of the brain, because they impact one another directly. Emotional trauma, on the other hand, can impact through the vagus nerve all of the organs of the body. And so there is a real physiologic connection between mind, body, and spirit. And so if this is something that is going on with you, if this is something that you would like to talk about, I would really love to offer you a free call. I'd love to, I'm going to put in the description of this video link that you can schedule a free call with me. I would love to discuss it with you. I would love to discuss some options and some interventions that might be helpful. And I would love to hear too what you've done or what you've struggled with that perhaps I can help. I hope that you will take me up on this offer. And I hope also that you will find me on Facebook. On my Facebook page, I have a practice page where I do a lot of educating and discussing interventions and physiology of Crohn's and ulcerative colitis. Follow me on YouTube as well. And please, if you have friends or family that have these diagnoses and are struggling with these things, please share this video with them. I really want to make a large impact on, and in a positive way. I really want to help as many people as I can who have struggled with what I've struggled with. I have a very unique perspective as both the patient and the physician who has struggled and been very, very ill, and who is now very, very healthy off all medications and has managed to reverse her disease and become so far into remission. I'm not even sure I have it anymore, but at least it doesn't feel like I do. So it's been a pretty incredible journey. And I would love to share any of that is helpful for you. Please take a moment, schedule a call with me. Think about this. Think about people in your life who may be struggling with this, who might benefit from watching this video, and please share it with them. I hope you have a wonderful day.